Welcome back, and thank you for joining me today. If this is your first time here, I'm glad you're with us. My name is Dr. Thomas Tuan, and I've spent many years caring for older adults with heart disease, high blood pressure, and stroke. Today, I want to talk with you about something that I believe many people over the age of 60 have never been told, even though it could have a real impact on their health. Millions of older adults take blood pressure medication every single day. Maybe you're one of them. You take your medicine, you check your blood pressure, and the numbers look exactly the way they're supposed to. Seeing those numbers can bring a sense of relief. It feels like everything is under control. But I want to ask you to stay with me for the next few minutes, because there is something those numbers may not be telling you. Even when your blood pressure looks perfect on the monitor, quiet changes may still be happening inside your body. Your brain, your heart, and your kidneys may be responding very differently than you realize. These changes often happen slowly. They don't announce themselves with severe pain or dramatic symptoms. That's exactly why so many people miss them. Now, let me be very clear. This does not mean your doctor made a mistake, and it does not mean you've done anything wrong. If you've been taking your medication exactly as prescribed, you've been doing what you were asked to do. The issue is often much more subtle than that. The blood pressure goal written in many treatment plans was developed using research that included people who were often much younger than many of today's older patients. As our bodies age, our blood vessels change. What works well for a healthy person in middle age may not always be the best target for someone in their late 60s, 70s, or beyond. That's the question we'll explore together today. Is the blood pressure number you've been aiming for actually the right number for your body today? By the end of this video, you'll understand why this question matters, what warning signs many people mistakenly dismiss as normal aging, and most importantly, you'll know the simple questions you should ask your own doctor at your next appointment. Those conversations can make a meaningful difference in helping your treatment fit your body, not just the numbers on a chart. Here's what concerns me the most. Some of the most important changes happening in your body may never show up during a routine office visit. You can go to your regular checkups, have your blood pressure measured, hear that everything looks good, and still be dealing with a problem that hasn't been recognized. Many people assume the danger comes only from blood pressure being too high. In some cases, that's true. But for many older adults, the problem can be the opposite. Your blood pressure may actually be lower than what your aging body needs. The difficult part is that this usually doesn't cause pain. It doesn't create an emergency that sends you straight to the hospital. Instead, the signs are subtle. You may feel a little lightheaded when you first get out of bed. You might notice a brief dizzy spell before your morning coffee. Maybe you find yourself reaching for the handrail as you walk down the stairs, even though you never needed it before. Most people don't think much about these moments. They simply tell themselves, "I'm getting older." It sounds reasonable, and that's why these symptoms are so easy to dismiss. But what if they aren't just a normal part of aging? What if those small changes are actually your body's way of telling you that your blood pressure has been lowered more than it can comfortably tolerate? That's the possibility I want you to consider today, because recognizing the difference can completely change how you look at your blood pressure and the conversations you have with your doctor. Many older adults tell me the same thing. They say, "Doctor, I guess this is just part of getting older." They describe feeling a little dizzy when they stand up, a brief sense of lightheadedness in the morning, needing to pause before taking the first few steps of the day, holding onto a railing when going downstairs. Because these symptoms often come on slowly, they become easy to accept. Many people assume this is simply what life after 60 or 70 feels like. But I want you to consider another possibility. What if those symptoms are not simply the result of aging? What if they are your body trying to tell you that your brain is not getting enough blood for a few moments when your blood pressure changes? That possibility is often overlooked because the symptoms are mild, brief, and easy to dismiss. They do not usually cause severe pain or dramatic warning signs. They simply become part of a person's daily routine. Throughout this episode, I will explain why this can happen, what is actually taking place inside the body, and why recognizing these small changes can be so important. By the end, you will understand why these symptoms deserve attention instead of being ignored. Most importantly, you will know the questions you should bring to your next appointment so you and your doctor can decide whether your current blood pressure goals truly fit your body's needs. After more than a decade of caring for patients with heart disease, I've found that the most important question is often not the one people ask. Most patients want to know, what is my blood pressure today? But the better question is, what blood pressure is actually right for a body that is 60, 70, or even 80 years old? Those are not the same question. As our bodies age, our blood vessels change. That means the same blood pressure target may not fit everyone. Many people believe that 120/80 is the ideal number for every adult. In reality, that is not always true, especially for older adults. Later in this episode, I'll explain an important medical concept called the J-curve. It helps us understand why lowering blood pressure is beneficial only up to a certain point, and why pushing it lower is not always better. This is one of the most important ideas in modern blood pressure care, yet it rarely gets explained in enough detail during a routine office visit. To understand why this matters, we first need to look at where the familiar blood pressure target of 120/80 came from. Most people have heard this number for years. Many believe it is the perfect goal for everyone, but that is not how it was originally developed. The research that established this standard was based primarily on middle-aged adults, many of them in their 40s and 50s. Over time, that same target became widely applied across nearly every age group, as if a person who is 45 and someone who is 75 have the same cardiovascular system. In reality, they do not. For a healthy, middle-aged adult, lower blood pressure is often associated with lower stress on the blood vessels and a reduced risk of heart attack and stroke. In that situation, bringing blood pressure down generally makes good sense. But once we reach our 60s and 70s, the picture becomes much more complex. The body has changed. The blood vessels have changed. What works well for a younger adult may not always be the best target for someone whose cardiovascular system has been aging for decades. That is why the same number cannot automatically be considered the right goal for every older adult. So what actually changes after the age of 60? The answer is not that you've done something wrong. It is not because you failed to eat well or stay active. These changes are part of the natural aging process. Over the years, more collagen gradually builds up within the walls of your arteries. Calcium also begins to accumulate. As this happens, the blood vessels slowly become stiffer and less flexible than they were decades earlier. Instead of expanding and relaxing easily with each heartbeat, they become more rigid. That change affects the way blood moves through the body. A stiffer artery needs more pressure to push blood forward, especially when blood has to travel uphill to reach the brain. If blood pressure is lowered too aggressively in an older adult, the brain may not receive enough blood during certain moments, particularly when standing up or changing position. That is when dizziness or lightheadedness can appear. Many people assume these symptoms are simply part of getting older. But in many cases, they reflect the way an aging circulatory system responds to blood pressure. This is an important distinction. The changes in the blood vessels are a normal part of biological aging, but that does not mean every older adult should be treated exactly the same way. As our cardiovascular system changes with age, blood pressure goals may also need to be individualized. The right target should match the needs of the person, not just a number printed in a guideline. At this point, I want to be very clear. Current blood pressure guidelines are based on strong scientific evidence, and they remain an important foundation for treatment. They recommend a target below 130/80 for most adults, and I continue to use that goal as a starting point in clinical practice. The key words, however, are most adults. They do not mean every single person. That distinction matters, especially after the age of 60. Some older adults have become physically frail. Some have already experienced falls. Others notice dizziness whenever they stand up, or they simply do not tolerate lower blood pressure as well as they once did. For these individuals, pushing blood pressure down to the same target used for healthier or younger adults may create a different problem. The issue is not that the guideline is wrong. The issue is that every patient is different. A recommendation designed for the majority cannot automatically become the best answer for every individual. In certain older adults, lowering blood pressure too much may increase symptoms instead of improving health. That is why treatment should always consider the whole person, not just the number on the blood pressure monitor. Let's look at what the current recommendations actually say. The 2025 guidelines from the American Heart Association recommend a blood pressure target below 130/80 for most adults. That recommendation is supported by strong scientific evidence and large clinical studies. It remains an important benchmark, and I use it regularly as a starting point when discussing treatment with my patients. But there is one phrase that deserves much more attention than it usually receives. The guideline says, for most adults. It does not say, for every adult. That difference is not just a matter of wording. It reflects an important principle in modern medicine. Some older adults are healthy, active, and tolerate lower blood pressure without any problems. Others have frailty, a history of falls, dizziness when standing, or blood vessels that have become much stiffer with age. Those patients may need a different blood pressure goal that better matches how their bodies function. The purpose of treatment is not simply to reach a number. The goal is to find the safest and most appropriate blood pressure target for each individual. That is why good medical care is always personalized. The guideline provides the starting point, but the final treatment plan should be tailored to the person sitting in front of the doctor. Let me share the story of one patient. I'll call her Mrs. Lane. She was 71 years old, a retired school teacher, and one of the most disciplined patients I have ever met. She walked every morning, prepared healthy meals, never missed her medications, and kept every follow-up appointment. By every usual standard, she was doing everything right. For years, her blood pressure had been around 148/84. Following the recommended treatment plan, her physician added a second blood pressure medication to bring her closer to the target range. 6 weeks later, her blood pressure measured 118/72. On paper, the results looked excellent. Her medical record showed what most people would consider outstanding blood pressure control. But Mrs. Lane did not feel better. In fact, she felt worse. When she came to see me, she struggled to describe what was happening. She did not have severe pain or a dramatic illness. Instead, she said that every morning her mind felt unusually foggy. She felt slightly dizzy whenever she stood up. Within just 2 weeks, she had nearly fallen twice while stepping off the small porch outside her home. She no longer trusted her balance. Eventually, she stopped taking her daily morning walks because she no longer felt confident walking on the same neighborhood sidewalks she had enjoyed for years. Several physicians had looked at her blood pressure readings and concluded that everything was under excellent control. After all, the numbers looked perfect. But I performed one simple test. I measured her blood pressure while she was lying down. Then, I measured it again, immediately after she stood up. The entire process took less than 3 minutes. Her systolic blood pressure dropped by 24 millimeters of mercury within seconds of standing. That was a significant finding. She had orthostatic hypotension. Each time she stood up, her brain was briefly receiving less blood than it needed. No one had recognized it because no one had looked for it. We adjusted her medications and set a blood pressure goal that matched her own body's tolerance instead of trying to reach the same target used for someone decades younger. Just 2 weeks later, the morning brain fog was gone. The dizziness disappeared. She returned to her daily walks with confidence. At her next visit, she said something I have never forgotten. She looked at me and quietly said, "I felt like I was disappearing." She believed that feeling was simply part of getting older. But it wasn't. It was her body's way of telling us that the treatment goal no longer matched what her aging cardiovascular system truly needed. Now let's talk about the J-curve, because this is where many people are surprised. Most of us naturally assume that lower blood pressure is always better. The logic seems straightforward. If high blood pressure increases the risk of heart attack and stroke, then lowering it as much as possible should continue to reduce that risk. That idea makes sense at first. But when researchers examined data from large groups of older adults, they found something different. Instead of seeing a straight line where risk kept falling as blood pressure went down, they found a J-shaped curve. At first, lowering blood pressure from very high levels clearly reduced the risk of cardiovascular events. That part was exactly what doctors expected. However, once blood pressure dropped below a certain point, the pattern changed. Rather than continuing to improve, the risk began to rise again. The curve bent upward, creating the shape of the letter J. This finding has been confirmed in multiple large clinical studies, particularly among adults over the age of 60. One of the most important observations involved the diastolic blood pressure, the lower number on your reading. When that number falls below certain levels, especially below about 70 millimeters of mercury, cardiovascular risk may begin to increase instead of decrease. The message is not that lower blood pressure is bad. It is that there appears to be a point where lowering it further may no longer provide additional benefit for some older adults. Beyond that point, the body may not receive the blood flow it needs as efficiently as before. That is why the goal is not simply to achieve the lowest possible blood pressure. The goal is to find the range that provides the greatest protection while still allowing the heart, brain, and other vital organs to receive the blood supply they need. To understand why this happens, it helps to think of your arteries as the body's natural shock absorbers. In younger adults, the large arteries are flexible. With every heartbeat, they expand to absorb part of the pressure and then gently recoil between beats. That elastic movement helps keep blood flowing smoothly throughout the body and helps maintain a healthy diastolic blood pressure, the lower number on the reading. As we grow older, those arteries gradually become stiffer. They lose much of their natural elasticity. When that happens, the upper number, or systolic blood pressure, often rises because the arteries can no longer absorb pressure as effectively. At the same time, the lower number, the diastolic pressure, may begin to fall because the arteries are no longer able to maintain pressure between heartbeats. This change becomes especially important for people taking blood pressure medication. If treatment lowers the diastolic pressure too much in an already stiff arterial system, the heart, the brain, and the kidneys may not receive the blood flow they need. Some people develop dizziness when they stand. Others may experience reduced blood flow to vital organs without realizing it. Several clinical studies have reported that among patients receiving treatment for high blood pressure, very low diastolic blood pressure has been associated with a higher risk of cardiovascular events in certain groups of older adults. That is one more reason why blood pressure management should focus on the individual patient, not simply on reaching the lowest possible number. If you're finding this information helpful, I'd really appreciate your support. Please take a moment to like this video, subscribe to the channel, and leave a comment below. Your support helps us continue sharing practical, evidence-based health information for older adults. Now, let's continue with the next important part. Now let's talk about the brain, because this is an area that deserves much more attention. As blood vessels become stiffer with age, they may not deliver blood to the brain as efficiently as they once did. Over time, reduced blood flow can affect how the brain functions. Some people begin to notice that their memory is not as sharp. Others find it harder to concentrate or realize that their reactions have become slower than they used to be. Because these changes often develop gradually, many older adults assume they are simply a normal part of aging. But that is not always the whole story. In some cases, these symptoms may also be related to reduced blood flow to the brain. If blood pressure is lowered beyond what an aging circulatory system can comfortably tolerate, the brain may not receive the blood supply it needs during certain moments. This does not mean that every memory problem is caused by blood pressure. It does mean that blood flow is an important part of the picture and should not be overlooked. For some older adults, the most appropriate blood pressure target may be different from the standard goal. Finding the right balance is one of the most important parts of personalized blood pressure care. Before we move on, I'd like to ask you a simple question. During your medical visits, has your doctor ever measured your blood pressure while you were lying down and then measured it again immediately after you stood up? Or is it usually checked only while you're sitting? Please let me know in the comments. I read your experiences because they help me understand what many older adults are actually seeing in everyday practice. In the next section, we'll talk about what these findings can mean and the practical steps you can discuss with your doctor. So what blood pressure should you actually aim for after the age of 60? The most honest answer is that there is no single number that is right for everyone. The best target depends on your overall health, your symptoms, and how your body responds to treatment. For many healthy adults between the ages of 60 and 75 who remain active, have never experienced falls, and do not become dizzy when standing, A blood pressure goal below 130/80 remains well supported by current evidence. Large clinical studies have shown that this target can reduce the risk of stroke, heart attack, and other cardiovascular events in this group. However, the situation may be different for older adults who are more physically frail, have a history of falls, experience frequent dizziness when standing, or have noticeable declines in overall health. In these individuals, the safest blood pressure target may not be exactly the same. This is reflected in the recommendations from the European Society of Hypertension, which recognize that treatment goals may vary according to age and overall health. For some older adults, particularly those over 80 or those with greater frailty, a higher systolic blood pressure target may be appropriate. The goal is not to treat the blood pressure reading alone. The goal is to treat the person. Good blood pressure management should always be individualized so that the treatment fits the patient's body rather than expecting every patient to fit a single number. Now let's discuss a condition that many older adults have never heard of, even though it is surprisingly common. It is called orthostatic hypotension. This occurs when blood pressure drops significantly after a person stands up from a lying or seated position. In medical practice, orthostatic hypotension is generally defined as a drop in systolic blood pressure of 20 millimeters of mercury or more shortly after standing. That sudden decrease may temporarily reduce blood flow to the brain, leading to dizziness, lightheadedness, or a feeling that you might lose your balance. Studies suggest that this condition affects a substantial number of older adults. It is also associated with a much higher risk of falls. For someone over the age of 60, a fall is never a minor event. It can lead to serious injuries and a significant decline in independence. Think about the moments when this is most likely to happen. You wake up in the middle of the night to use the bathroom. You finish working in the garden after kneeling or squatting and stand up quickly. You get out of your favorite chair after watching television. These simple, everyday movements are often when orthostatic hypotension becomes most noticeable, because the body has not yet adjusted to the change in position. That is why these brief episodes of dizziness should never be dismissed automatically as just getting older. They may be an important clue that your blood pressure needs a closer look. Before your next appointment, I would encourage you to bring 3 simple questions with you. If it helps, write them down or keep them on your phone. These questions can lead to a much more meaningful conversation with your doctor. The first question is, could you check my blood pressure while I'm lying down, and then again after I stand up to see if I have orthostatic hypotension? This test takes only a few minutes, but it can reveal changes that a single blood pressure reading taken while sitting may completely miss. The second question is, based on my age, my blood vessels, and the symptoms I'm experiencing, what blood pressure goal is right for me? This reminds both you and your doctor that treatment should be tailored to your individual health, not based only on an average target used for the general population. The third question is, are any of the medications I'm taking contributing to dizziness, lightheadedness, or confusion? In older adults, orthostatic hypotension can sometimes be related to blood pressure medications or to the combination of several medications taken together. Reviewing your medications as a complete list is often more helpful than looking at each prescription one at a time. Before your visit, bring an up-to-date list of every medication you take, including prescription drugs and anything you use regularly. Having that information available can make it much easier for your doctor to review your treatment plan and decide whether any adjustments may be appropriate. I'd like to end this discussion by returning to Mrs. Lane's story. 4 months after we adjusted her treatment plan, she came back for a follow-up visit. She had not experienced another fall. The dizziness that used to occur every time she stood up was gone. She was once again enjoying her 45-minute morning walks along the same familiar route through her neighborhood. Her blood pressure at that visit was 138/76. It was higher than the 118/72 that had once looked so impressive on paper. But this time, it was a better match for her body and how it actually functioned. What mattered most was not that the number was lower or higher. What mattered was that she felt well again. She could think clearly, move with confidence, and return to the daily activities that were important to her. In her case, the blood pressure goal that best supported her health was the one that fit her individual needs, not simply the one that looked perfect in the medical record. Before we finish, Let's bring everything together. The familiar blood pressure target of 120/80 is an important reference point. It provides a useful starting place, but it is not automatically the right destination for every older adult. After the age of 60, the cardiovascular system changes. Blood vessels gradually become stiffer, and the body may respond differently to blood pressure treatment than it did years earlier. That is why the J-curve is so important. In some older adults, lowering blood pressure below a certain point may no longer provide additional benefit and may even increase risk. We also discussed orthostatic hypotension, a condition in which blood pressure drops after standing. It is common in older adults and can contribute to dizziness, balance problems, and falls if it goes unrecognized. The key message is that blood pressure treatment should be individualized. The goal is not simply to reach a number. The goal is to find the blood pressure range that best supports your overall health and daily function. As you prepare for your next appointment, remember the 3 questions we discussed. Ask whether your blood pressure can be measured while lying down and again after standing. Ask what blood pressure goal is most appropriate for your individual situation. And ask whether any of your medications could be contributing to dizziness or lightheadedness. Those simple questions can lead to a more personalized conversation and, in many cases, better care. Thank you for staying with me through today's discussion. I truly hope this conversation has helped you look at blood pressure a little differently, especially if you are over 60 or caring for someone who is. If you found this information helpful, please consider sharing this episode with a family member or a friend. Sometimes one simple conversation can help someone ask the right question at their next doctor's appointment. If you enjoyed today's podcast, I would also appreciate it if you subscribed, left a comment, and joined us for future episodes. Your support allows me to continue creating practical, evidence-based health education focused on healthy aging and heart health. In our next episode, we'll take a closer look at the blood pressure medications most commonly prescribed for older adults. We'll discuss how each type works, which side effects are more common as we age, and why some medications may affect balance, energy, or even memory more than many people realize. It's an important conversation that I hope you'll join before your next follow-up visit. Before we finish, I want to leave you with one important reminder. Please do not stop, reduce, or change any of your medications based only on what you've heard today. Every person has a different medical history, different health conditions, and different treatment needs. The safest approach is always to bring these questions to your own physician and have an open conversation together. That partnership is where the best medical decisions are made. Thank you again for spending this time with me. Take good care of yourself, stay curious about your health, and continue listening to what your body is telling you. I wish you good health, steady strength, and many active years ahead. Until next time, take care, and I'll see you in the next episode.